Early this year, Rory O'Neill made a speech at the Abbey Theatre about acceptance and the experience of growing up gay. So far, more than 600,000 people have seen it, and a lot of them, particularly a lot of people in the gay community, say it was representative of experiences shared by so many, but voiced by few.
It was a fabulous speech, Rory, I have to say. Absolutely superb. Now, Rory is fronting a new campaign, Know the Score, Get Tested, which aims to encourage gay and bisexual men in Ireland to get tested or to retest for HIV and to stress the advantage of knowing your HIV status. Rory joins us this morning along with sexual health specialist Dr. Shay Keating. You're both very welcome this morning.
Thank you.
Doctor, I'm going to come to you first, actually, to talk about stats. Like, what is the reality of the situation in Ireland at the moment from the point of view of, you know, when it comes to testing and HIV? Do we know how many people are HIV positive in this country? Do we know if those numbers are on the increase?
Okay, the numbers are obviously on the increase all year on year. I think it's quite frightening if you go back to, say, 2012 and look at the number of people who were diagnosed with HIV. In spite of all the education, 300 plus. Now, this year, 344. So, like, there's no change, no let up at all in the number of new diagnoses, which is quite frightening.
And it's very frightening. Are those stats particular to the gay community, or is that amongst heterosexuals as well?
Well, they're obviously any person who has sex potentially can get HIV. It's not exclusively a homosexual problem or something for men or sex with men. But from 2005, we say, up to 2012, there's been a 180% increase in HIV in men who have sex with men. 180% increase, yeah.
Why do we think this is? Is it because, you know, back in the 80s there was this huge campaign, there was massive awareness, and it's just fallen out of people's consciousness?
I think it has. You must appreciate that it's 30 years to the day that HIV was first identified as the cause of AIDS. So there's a lot of information that's come and gone. And a lot of the people now who are testing, they actually weren't even around 30 years ago.
Yeah.
So is part of it that people aren't as frightened of it as they once were?
It's true. Yes, absolutely. They're not as frightened. I think we're almost victims of our own success in the medical world. That HIV is such a treatable illness. It's, you know, if you're infected with HIV, you go on medication, you live a completely normal life.
It used to be seen as a death sentence, and now no longer.
No, it's not.
Well, Rory, I'll come to you at that point, because you are living with HIV. You're HIV positive.
Yeah.
When were you diagnosed? When did you discover HIV?
I was diagnosed in the bad old days in 1995.
Wow.
But that was really on the cusp of when things were about to change. So when I got my diagnosis, it was a death sentence as far as I was concerned, and as far as my doctor was concerned. I mean, you know, what I remember most of that diagnosis is my doctor. I felt so sorry for him, because, you know, he was delivering a death sentence to somebody in their 20s, and I really felt for him. It was bizarre, but I was very lucky, because within a couple of years, the new treatments, antiretroviral treatments, started to come on stream, and so I was never, you know, when I was first diagnosed, yes, it was very grim going to the clinic and people were sick and dying, but very quickly that all started to change, and so there was always then this progress of things getting better, to the stage now where it's very much a treatable chronic condition.
How did you realise something was wrong? What were your symptoms?
I had no symptoms. I just went for sort of a general, I think I was feeling a little generally under the weather. But it came as a huge shock to me. I was not expecting it. I was not, you know, and I'm from the generation that was very much aware of it, and I had known lots of people who had, you know, sick and died.
I mean, it really was a unique diagnosis. It wasn't even like cancer where you say, well, there may be some treatment options. It was, you have HIV, this goes only one way.
Yeah, when I was diagnosed, there was very much, you were immediately put into the system. Like Dr. Shay in the clinic, there was this sort of system where you were sort of put on this conveyor belt, and it was just accepted that this conveyor belt was about to end at a funeral. And along the way, you were like, on your first day at the clinic, you went to see the social worker who told you about, oh, you know, you can get a blanket allowance, because it was assumed you wouldn't be working anymore. You know, that was the tone of it at the time.
It's changed so much,
totally different now. Totally different now.
Now, what does living with HIV mean for you? How does it affect your day-to-day life?
It almost doesn't.
Okay,
wow. If you're very lucky, you can take treatments that involve one tablet a day. Some people can't, for various reasons, take that one, but you might have to take 2 or 3 tablets a day. And I don't think about it. I can go months, because you take that tablet on autopilot, and I can go for a long period, and I never even think about it. The only time I actually really think about it is, you know, I go to the clinic 4 times a year, like it's nothing. Nothing. The only time I really think about it is when these kind of conversations. Yeah. I always describe it this way. I have a small tattoo on my back, and I forget that I have a tattoo until a conversation starts about tattoos and oh right, and I can't even remember which bloody side of my back it's on.
Because you are functionally cured. I mean, it effectively is.
Essentially. Now, I don't want to downplay it. It is a huge pain in the neck, you know. But the truth is, yes, I'm healthy and manageable, and like most people nowadays on treatment, you know, I'm called what's undetectable. They can't actually find the virus. So for example, I wouldn't be infectious per se in all that sort of way. So, but the reason it becomes a problem ever is there is still a stigma about it, and that's the problem.
How do people react when you tell them?
People are still, because they don't have all the information, so people still get freaked out. And people who shouldn't get freaked out, and you can imagine, you know, for example, people in the gay community who should know all the advances and the changes and what it means, they don't. So some people really do get freaked out about it, and there's still this sort of shaming about it, as if there's still this undercurrent, as if, oh, well, you know, you should have known better. Why? You, in a way, you kind of deserved it. And I'm not here to have this sort of moral argument today. That's not it. But, you know, all that stuff is just bull. I mean, you know, we shamed people for their sexual choices in this country for generations. And where did we end up with that? You know, water tanks full of dead babies. Do you know what I mean? So
the bit where obviously it is going to be most difficult would be in new relationships. So I assume there had to be interventions where you would say, listen, by the way, you need to know. How do you handle that?
If I could change one thing about it, and this just sounds so... You know, in the old days, I just didn't want to die. Nowadays, I just don't want to have that bloody conversation anymore. You know, because I'm single, and every now and then, occasionally, I bizarrely find somebody who might want to date me. And I have a 3-date rule. Look, there's no point in telling somebody straight up the first date, because they don't even know you, and it's too easy for them just whatever. So I have a 3-date rule myself. Everybody has a different. And on the 3rd date, I then tell them, and it's an annoying and awkward conversation.
And what do they say? What sort of reactions do you get?
It totally depends on the person. Some people you literally never see them again, and but some people really surprise you, and especially younger people sometimes. Because sometimes I think, oh God, you know, he's not my age. He's a little younger, and you know, I think when I was a bit younger, I would have been more freaked out by these kind of things. And some people will surprise you. But, you know, I've become very good at explaining.
I'll just say one thing.
Yes.
I think Rory did exactly the right thing. He was diagnosed. He knew as to his HIV diagnosis because he went to get a test. Now, Janssen they've got this new online locator map.
Man-to-man.ie, yes.
Yeah, you can actually access the map on man-to-man.ie or dublinaisalliance.ie. It's a very, very
and it tells you where your nearest testing centre is.
Absolutely, yeah.
For free testing.
Free testing, which is usually important.
Yeah, it needs to be free. But do you think, is the increase in the stats with people showing up with HIV, being HIV positive, is that because people just aren't concerned about it anymore, Rory? Is there a whole generation of young guys?
There's a combination of reasons. Some people would say that actually because they don't know where to go and get tested and how easy it is and it can be free, so that's something that we're trying to address now. But on top of that, it is true that if you are 23 now, you did not grow up with those ads on the TV, and to you it's this kind of vague, faraway thing that maybe older gays had to worry about, and they honestly feel, well, every 23-year-old feels invincible anyway, and then nothing will ever happen to them. But they honestly feel that this doesn't even impinge on their life. And that's a problem that is partly to do with the stigma too. Every single person, you all know people living with HIV. The problem is, because of the stigma, not everybody is prepared to sort of publicly say that. And if they're, you know, if that stigma was taken away and people felt comfortable saying, you know, in the same way that they might say, oh, you know, I have, you know, whatever other condition, then you would all realize, oh my God, yeah, I do know people with HIV, and young people would then realise it does.
Sexual behaviour were very surprising in the research done by Janssen. I mean, there was indications of, I think it was something to the order of 1 in 10 men who have sex with men who do so consistently and constantly without any form of protection.
So it is very, very worrying. Very, very worrying.
And I mean, how is the message being lost?
I would say about that, first of all, that's partly the thing again. Younger people honestly feel that this doesn't affect them. And because people are not looking sick anymore, you know, they're not seeing people like we would have, you know, 20 years ago. So they honestly think it almost doesn't exist in a sense. But also, too, you know, when you're 23 and, you know, especially if you've had a few drinks on, you make bad choices. That's how, you know, there was a time in this country when, you know, being a young woman and becoming pregnant out of wedlock was worse than a fatal diagnosis. And yet, did that stop hundreds of thousands of, you know, young girls getting pregnant? It didn't, because, you know, your biological drive to have sex is stronger than, you know,
If you do get tested, I assume it is not something that you do once. It should be something that you regularly check back in.
Well, obviously, if you're in a monogamous relationship, you don't need to get tested very, very regularly. But if
as long as you trust the partner,
as long as you trust, absolutely, as long as you trust your partner. But if you're having sex with different people, you need to get tested on a regular basis, and you need to get tested at least twice a year. You're only as good as your last HIV test.
The stats that we were talking about, Shay, are they representative, or are they just the tip of the iceberg? I mean, is there a whole gang of people out there who just aren't going to be tested?
Oh, absolutely. It's actually quite
and that's quite fearful. That's worrying.
Well,
if there's a whole load of people out there who are having sex, maybe unprotected, and don't know that they're HIV positive,
well,
that is cause for concern.
If you read the stats, 80% of men who have sex with men don't believe that they're at risk of HIV. I mean, that's
80% of men who have sex with other men don't believe they're at risk from HIV. Yeah. How can that be so? I don't understand that. Yeah. I just don't get that.
Well, because most of those 80% are, under 30, and they
have brains, they can read, they can hear.
I know, it's shocking.
It is shocking, which is why you're...
An early diagnosis is so important because to start treatment early is very important, but also the sooner you start treatment, the less likely you are that you could ever infect somebody. Because if you're infected but don't know it and not on treatment and then have sex with somebody, you can very easily infect somebody. But if you're on treatment and you're I know the doctor won't come quite out and say this, but essentially you're not infectious if you're...
I would come out and say that because there's I don't know if you're aware of something called the Swiss report. Swiss report was launched in Switzerland, obviously, in 2008, and the point they made was, if you're HIV positive, okay, you're on the appropriate medication, you're, as Rory is, you're virally suppressed, you've been undetectable amount of virus in the blood for at least 6 months, and you don't have another sexually transmitted infection, you're not infectious.
Wow, I did not know that.
So they've kind of got off the fence and named it.
For a long time they didn't want to say that for political reasons, in a sense, because...
If there are young guys watching this morning, or parents of young guys, mantoman.ie is the website they need to check out.
Or DublinAIDSalliance.ie also.
Okay.
So it's hugely important that you go and get tested, know your
on the website there's like a little map and you can click into it and it'll show you everywhere in the country where you can go and get a free test and which one is closest to you. Yeah.
Rory, thank you very much for coming in and talking about that this morning. So glad you are well and healthy.
I am indeed.
Shay, thank you very much for all that information. It was very enlightening.